Hi, how you doing everybody? It's Alex Watson, Clinical Director and CEO at Osteopathic Consultancy, just checking up on how everybody is. Hope you're all doing well, fit and healthy. As far as we're concerned, we're all fit and healthy. Sharon, myself and my kids are all fit and healthy, and we've not had any symptoms of the coronavirus. Casper's had his blood thinning medication, so we have been doing that for the last sort of 7 to 10 days, and we think he's starting to walk a little bit better, certainly out running around in the garden a lot better, so he's doing much improved. Unfortunately, Hayley and Nathan are still furloughed, so we're dropping in with them every week, just having a quick chat on Zoom, checking how they all are. They're fit and healthy, their families are all fit and healthy as well. We've got exciting news. We've got our new website up and running, which is great. It looks really good, much improved on the last one. So we're really pleased with that. It is in planning, but we've obviously accelerated it, and that's kind of come on really nicely. So that's up and live. Anyone out there that's been following us on Facebook Live, we've been doing Facebook Live at 2 o'clock on a Saturday. So the first part, we split it up now into the first section will be stretching. So if you don't have a foam roller, you can do stretching sessions. So the first session we did lower legs, and I followed up with a bonus session with just using a foam roller. So we're going to do this ongoing now. So the first part of it from 2 till 2:30, but it'll be roughly 15-20 minutes. Will be combinations of 3 or 4 stretches, which will help free up section of the body. And the second part will be a foam roller. So if you don't have a foam roller, it'd be a good idea to get yourself one, because it will help keep yourself a bit more mobile. Doesn't mean that I can choose which type of foam roller you're going to use, but the ones with knobbly bits are kind of a bit better, and then a flat area as well. But you can use any foam roller. It's very useful and free muscles up. It doesn't mean it's clinically safe for you to use, so make sure that you're only using it if you're being advised by us that it's safe for you to use, because certain things we use with foam rollers in certain age groups and people are contraindicated, so make sure you do those when you're directed. So the first section of stretching and mobility at 2 o'clock on a Saturday, and then we've got a 2:30 the foam roller inhibition, and those two things are really helping keep people mobile. Fantastic connections. We've been chatting to people all over the place, Yorkshire and Eastbourne, giving them a bit of help, and I've seen them a few times on virtual appointments as well, which is really nice, and helped them nicely as well. Brings me on to the virtual appointments, seeing about 30 odd virtual appointments in a week. The patients are doing really well. We're keeping on top of a lot of their problems, and we're making some really good improvements. And actually, I must admit, like everything, as you start to learn and get into it, you really start to improve as a practitioner. About 85-90% of the osteopathic profession aren't working right now. I've decided against doing virtual appointments, so I just feel like that would be a harsh thing to do. So we've been doing the virtual appointments, which is having a great deal of effect. They do take a lot longer, so we're putting aside 45 minutes to an hour to do them, so it's significantly longer than a normal half-an-hour appointment. But actually, the patients then can use those in between sessions to repeat the combinations of foam rolling, so that they're going to be able to get themselves a bit more self-help going forward, which is brilliant. I've been carrying on doing my Surrey Prepared, so I've adopted some grandmas in my local estate, so just sort of shopping and prescription runs, which is great. My daughter Becca helped me out with that one as well. She did a couple of prescription runs as well, which is great. Sharon, myself, or mainly Sharon, deep cleaned the cabin, so the cabin's deep cleaned top to bottom and sterilised throughout, which has been brilliant, steam cleaned. We've been checking in with our patients, so just trying to see, is there anything we can do, give them any support, anything they need advice wise, then we kind of help them out, which is, the patients are really responding well. So if you need a hand with anything, you need any advice or support, then obviously we're here for you. When I say we're here for you, it's basically me, so bear with me, the phone is ringing and the emails are coming in. I don't have lovely Hayley to help us, so I am struggling to keep on top of everything, but I am getting round to everybody. But if I don't get round to you immediately, please bear in mind I'm struggling to keep on top of everything. What I've been doing is I've been triaging patients. So if people ring up and they're in a lot of pain, And there are certain criteria that we're using to work out what's going on. So we do a bit of a case history, understand what's happening, and we've always done that in the past. So if patients are not sure whether treatment is applicable or not, what we do is we do a telephone chat just to see whether we can help. So we realised that actually it might be a good idea to actually formally offer that as a free telephone consultation, so that we can have a chat through your problem if you're worried about something, you're not sure where to go, not sure what to do. So right now with COVID, obviously people are not wanting to access the NHS, quite rightly, because there's obviously inherent dangers with that. Some of my patients have accessed their GP, nurses, nurse practitioners, hospitals, A&E, and obviously those places have a significant risk to them. So we have been triaging those patients, and if we feel like it's clinically required and it's clinically appropriate, then we offer them a face-to-face appointment with myself using PPE equipment, which looks a bit scary with masks and gloves and an apron on, but and we've been doing a car-to-car service. We pick you up off the driveway, bring them into the clinic, come in, wash your hands, and then we go through your mechanics as we do normally, and then we sterilise the plinth down before and after and everything you touch, and then make sure that we give you alcohol gel on the way out to make sure we keep you nice and as sterile as possible. And I've been advising people just to throw all their clothes in the wash. So we don't take anyone that's actively having COVID symptoms. Not that I've had anyone in the clinic complaining for COVID symptoms, but if you had COVID symptoms, that wouldn't be appropriate, because there would be an increased risk to myself and yourself. What we've also been doing is if that you're immunosuppressed, or whether you have someone that is in a vulnerable group that you're at home or in contact with, then that wouldn't be appropriate as well, because that would be a risk as well. So those people that then don't fall into that category that require a face-to-face appointment, then we move on and sort of offer a virtual appointment. Virtual appointments are going very, very well, because if you're not that extreme, then the virtual appointments have an excellent result. So a lot of my patients are absolutely flabbergasted. One said, "Oh, it's surprising what can be done by Zoom." One guy had nerve root symptoms. The nerve root symptoms leg had gone with a virtual appointment. So I said, well, let's just try one, and it went extremely well. So the virtual appointments are going very well. So those are the two options. So we're going to offer a formal triage service, a free telephone consultation, so that we can work out what the best route for you is going forward, and then we can work out which route to go down. I think that will really help a lot of people, because I'm realising when people are ringing up, they don't really know whether I'm open, what I'm doing, and I've been a bit reticent to sort of come out and tell everybody about the possibility of triaging patients, because I'm not sure how much work I could actually take on. So I am quite busy as a one-man band. So what we want to do is kind of like saying to people, there is that possibility to triage and then give you the support in the appropriate way. So whether it be a face-to-face, or in cases, what happens sometimes is you do a couple of face-to-face, and then people have been dropping on to the virtual appointments afterwards. I think that's a roundup of everything. I hope you're all fit and healthy at home. I hope you're all staying safe. I hope you're all doing your exercises. I hope you're all doing some nice steady walking, not taking any risks of kind of like what I've been calling the COVID crazies, people going out and doing loads of crazy amounts of exercise. So make sure you keep yourself mobile, make sure you be sensible. And if you're not sure what you're doing, then we're obviously here for you to contact whenever you need us. So anyway, that's our end of our newsletter. Hopefully I'll be seeing you on Facebook Live at 2 o'clock and at 2:30. Otherwise, I'll be seeing you in the clinic soon. Take care, guys. Bye-bye.